Hey, if you've got stiff and tight neck muscles that are coming from a neck strain, then the exercises that I'll be showing you in this video are going to help you out tremendously. I'm Dr. David Midoff, specialist physical therapist from Paso Manual Physical Therapy, and this channel is dedicated to helping people stay healthy, active, and mobile while avoiding unnecessary surgery, injections, and pain medications. Please subscribe to our channel so that you don't miss out on any of the helpful videos that we post every single week. I'm about to get into the 3 exercises that are going to help you free up your stiff neck. But before I do, I want to encourage you to watch to the end of the video because I'll be talking about things that you should do in case these exercises don't work. There's a few things to consider so that you can know what next steps to take and you're not lost and confused about how to get rid of this stiffness in your neck. Now, these exercises unfortunately can't help every single neck problem out there, but they'll help a significant majority of people with neck problems, and hopefully that's you. But just in case it doesn't, I've got more information to help you out with your neck problem. Now let's get into the first exercise, double chin mobility. Now, as the name implies, you're going to be making a double chin in this exercise. Actually, all of the exercises are going to have a double chin. I'll show you the basics of this. Now, this is a double chin. This is my double chin. I know some of you out there are saying, well, he has 3 chins or 4 chins, or maybe you're saying that about yourself. All you have to worry about when you're doing your double chin is think about what muscles are firing behind your throat. There's some muscles right behind your throat, your airway and your passageway for food, your esophagus. These muscles are right against the front of your spine, of your neck bones right here. They're called the deep neck flexors. And you can feel them tighten up if you do a max double chin. If you go all the way down like that and hold it for a bit, sometimes you gotta hold it for 10 seconds or so, you should feel the muscles right back in there starting to get tired or tighten up a little bit. Those are your deep neck flexors. Now you need to engage those at least a teeny tiny little bit when you're doing these exercises. For you, instead of going 100%, I want you to back off to about 50, maybe even 25%. Find the spot where your neck muscles, your deep neck flexors, just barely begin to turn on. So for me, when I start doing a double chin, right there, I can feel them very subtly engaged back there. That's perfect. I can go a little harder if I want, but I want to caution you against going too hard. Make sure you keep it to right on the edge of when those muscles fire. So for me, it's about right here. So keeping that slight baby double chin, now you're going to go through your mobility exercises. We're going to go through flexion where you bend down, side bending, and then rotation. Now we're not going to do extension looking up because if you're trying to get more mobility, people tend to have plenty of mobility going in this direction already. Even though your spasm might not let you, your muscles might be spasming up, and the ones that help you to go back in this direction may hurt more when you go in that direction. But trust me, to fix this problem, you've got to turn on those deep neck flexors. They're usually not active in people with neck spasms. So we've got to get these deep neck flexors working better to get this strain going away, the spasm going away, and get your stiffness out of here so that you can have more freedom of movement in your neck. So back to your double chin. Then we're gonna go through flexion. So we're gonna do 3 reps, like so. Take your time going down, and then come back up to the starting point about right there for me, where I'm looking straight ahead at you. And then I'm gonna keep my double chin going about 25% to 50%. And I feel a little bit of a stretch back here, but nothing painful. If you are having pain going through just a part of that motion, stop where you have pain or the edge of it. Don't push into it. You're just gonna go up to where, say it hurts right here. I can go all the way down here, but say it starts to hurt me about right here. That's the stopping point. Then you're coming back to the middle. Now, 3 reps is the baseline. You could do plenty of this. You could do 10, 20, 30 reps, 50 reps. And as long as you're not pushing into pain and you feel these deep neck flexors going, you're good. It's probably going to be very beneficial for you to do extra. So hang out on this first exercise for as long as you like, as long as you're getting improvements in your neck mobility and decreasing the pain and getting more freedom of movement in your neck. So the next motion you're going to do, same exercise still, baby double chin. Then you're going to do side bending. Bring your ear over to your shoulder while still pointing your nose forward. I'm just going to go to my right 3 times here, maintaining, checking that my chin went down a little bit. And I felt those muscles turn on and getting a bit of a stretch on this side. And for me, I can feel things popping and shifting in my neck. That might be the case for you. Sometimes you don't get popping or shifting. That's okay. As long as the popping or shifting isn't painful, like lingering pain, you're okay. It's probably the joint that was stuck that needs to free up to calm the muscle down that's strained. So let's go the other way. Double chin, baby double chin. Yep, a little pop there. 2, I feel a big stretch. 3, do one more. 4, felt good. Now I'm going to turn over to my right, but maintaining a double chin. So when I turn, the goal is going to be to bring my chin over to my shoulder rather than my ear to my shoulder. That's what I was doing with rotation, with side bending a second ago. So double chin, then turn. Felt a lot of crunchies in there. And it got better this time, no crunchies. Bringing my chin over to my shoulder. One more. And then I'm going to go to my left over here. Double chin, turn over, double chin, turn over. And I can go as far as I want to there. My neck bones just stop me. But again, I can't stress enough, if you have pain going into a specific direction, do not push into the pain. Stop at the very edge of it. So if it hurts you to turn left or side bend this way, then just do your double chin first, always. Then say it hurts right there, just stop right there. And if you just move into that direction over the course of 10, maybe 20 reps, you might find that you can go a little further and a little further and a little further. And as we do the next exercises, they should also help out in getting more motion. And you might need to come back to this exercise, replay the exercises here, and do them again. If you keep getting benefits out of it, why the heck not keep going? All right, let's cover exercise number 2, double chin with an overhead reach. So you're gonna go back to your double chin, same exact intensity as you did before, what worked for you without pain, and maintaining your double chin, you're gonna do an overhead reach, but you've got to throw in a shrug. Now here's the key thing. When you shrug, people typically lose a double chin and their head goes kind of up a bit and their chin flies out forward, kind of the opposite of what a double chin is. So I need you to just be conscious of where your head and chin are in space when you do your double chin, because when you start to reach up overhead, you need to maintain it. And what you'll find is as you shrug, like I'm gonna have you do, your head, you have to kind of fight to stay in this position because your head wants to go like this, but you have to keep your head right in that same position that you started with. So head still, baby double chin. Let's get into the exercise now. You're gonna reach up overhead. Once your hands are about right here, begin to shrug your shoulders, keep your chin in position, and then go all the way up, hold it there for 10 seconds, as high as you can, as long as there's no pain, and it's some effort. Double check my chin is down. Now, if you have pain in this exercise, 1, check your chin is down right, not too hard, but some, and then make sure that you're shrugging all the way, and if you're not shrugging all the way, then push yourself to go up even further. That could be the reason why you're hurting. Another reason, the more common reason you might be getting pain, is that the shrugging muscles might be one of the muscles that are spasming. So only shrug what you can without discomfort. Quick side note here, spasms happen because a muscle is not behaving the way it was intended to. It all of a sudden contracts, and when it contracts for long enough, it becomes injured, and now we call that a strain. So I've been saying spasm and strain kind of interchangeably here because they're on a spectrum. Once a muscle starts to spasm, a muscle spasm is literally an uncontrolled, an involuntarily controlled contraction. Like I'm controlling this contraction right here. I'm squeezing my fist, which makes these muscles work. But if they all of a sudden just start seizing up with me intending it to, that would be like a spasm. That's what happens up in the neck. You're not intending to make that muscle get real tight all of a sudden, but it does. If it stays like that for long enough, then the muscle becomes injured, and we call that a strain, a muscle strain. So they're on a spectrum. Okay, back to the overhead reach exercise. Double chin, big shrug, maintain your double chin. And if it hurts to go higher, then you could back off or double check that you're going high enough. So you have to trial and error both situations. Does it hurt less if you go all the way up 100%? Or does it hurt less if you just hang out at 50% or 40%? So for me, I feel good going 100%. I'm gonna go all the way up and hold it for 10 seconds in my third round. And you're gonna do 10 reps like this. Shrug, holding your double chin. And I am trying to shrug as much as I can. My feet are planted on the ground firmly. My hips and my back are stable. I don't feel like I'm wobbling all over the place. And I am shrugging as hard as I possibly can. And I'm feeling these muscles fatiguing. Now separate pain from muscle fatigue, because pain hurts, it just doesn't feel good, versus muscle fatigue, it kind of relaxes things afterwards. You want that relaxation effect afterwards. It shouldn't be painful, like where you're grimacing. Like right now, it just feels like I worked out a bit. I'm even starting to sweat a tiny bit. I can feel myself, starting to glow. That's the effect that you're looking for when doing this exercise. Just like that. Now, these two exercises, the double chin mobility exercise we did, and then this overhead reach with the double chin, are setting you up for the final one. I'm gonna do one more. We'll say we did 10. Double chin, big shrug, hold it up. Because the final one, you're gonna use a towel, or in my case, I have a pillowcase here, to really move your neck joints. You're gonna stretch your neck joints out just a bit, and that helps to free up the muscles and cause that strain to heal and diminish. So I've got a big pillowcase here. You can use a towel, anything that's about this size. So this is probably about 3 feet long, a meter or so long, by 2 feet, maybe 1.5 feet. And you'll see how I have it set up. You'll find something in your house. I'm sure you have something available to you that you can use. A piece of clothing will work pretty well too. I folded it in half the long way, and I'm gonna do it again. Fold it in half the long way again. It doesn't have to be perfect, because then what you're gonna do is wind it up, twist it, just like that. And the tighter you make it, generally the better, because that's gonna go against your neck. So put that over your neck, and then you're gonna switch hands at this point. You see that? So now in this case, my left hand is pulling the right end of the pillowcase, and you can position that pillowcase on the stiffest part of your neck here, where you have some tenderness or where you feel like the muscle's most strained or spasmed, and get it right on there. Then what you're gonna do is double chin, little dip, double chin right here. And as you double chin, pull the pillowcase over and allow your head to kind of go with it as you maintain somewhat of a double chin. Now, you may lose a double chin as you go further in. That's okay, allow it to happen. Once you get to the end of what you can feel like you can go comfortably, then you're gonna just bounce your hand there at the end a little bit to get the joint to move, to get the muscles to move. So get all the way over, then bounce, like so. And if you feel like you need to go a level up or a level down, just adjust it a little bit, do that. If you need to tighten it up a bit more to get a little more firmness, or untighten it because it's a little too firm, you could adjust how firm it is. Like that just feels a lot more gentle on my neck, but I feel like I can tolerate, and I kind of need a bit more hardness. Yeah, that's more effective for me. And if you need to do the other side, you just switch hands. And same thing on the other side. Adjust it higher here. Just balance a little bit at the end, maybe 10 to 20 reps. I got a pop there. A little bit lower. 10 to 20 reps. And this frees up your neck tremendously. Already I feel tremendously more free. I was getting little pops and crunchies. I was on the computer for a couple of hours before this video, and so I literally was getting stiff in my neck as I was typing all my words up in all my preparation for this video. And so I'm actually way more free at this point in my neck after having done all 3 of those exercises. I hope that you got the same benefit out of doing these exercises. Now, this doesn't help everyone out. Like I said, I can't stress that enough. So, I know we'll get comments on the videos here of, oh, this didn't work for me. Well, you want to hear this next part then, because if these exercises didn't work for you, here's 3 things to consider so that you can take the next steps on fixing your neck problem. Number 1, did you do your double chin too hard? If you were really cranking that chin all the way down and then doing your shrugs and then doing your mobility exercises, that can make all the muscles in your neck simultaneously contract, including the muscle that's strained or spasming. And that could make the situation more painful. You really want to be careful to just barely do the double chin to where you feel those deep neck muscles. And if you don't quite feel those deep neck muscles engaged just by themselves, then you probably need to spend some time just practicing this little baby motion right here so that you can get those deep neck flexors to fire just a tiny bit. When they fire a little bit without everything else going on, then you're in a good spot to begin doing these exercises. So go back and try that and try the exercises again. Make sure that you can get just the deep neck flexors to fire with those mobility exercises and with the overhead reach, and see if it does give you benefit at that point. Number 2 thing to consider is you might need some hands-on treatment. It could be that your muscles and joints are so stiff that you need to get a healthcare professional like a manual therapist like myself to free up the joints by hand one by one, to free up the muscles by hand, and you will feel tremendously better. If you can't access a manual therapist around you, we are kind of rare out there. There isn't many people that specialize in manual therapy like we do here. Then a chiropractor might be a good fit for you, or possibly even a massage therapist. They just may not be able to get super specific on the level. It really depends on their training. There's a lot of variability between chiropractors amongst themselves and massage therapists as well. And the third thing to consider is you might have something more serious going on than just simply a neck strain. It could be something like stenosis, a pinched nerve in your neck. It could be a disc problem, or even arthritis. Now, I've got plenty of information about all of these conditions in our channel. I've linked a bunch of relevant videos down in the description. So if you try these exercises out, or you're just curious to see what are the symptoms, what else is going on, what does arthritis or stenosis look like, go down to the description and find those videos in there and go check those out to learn about how to begin to fix your neck problem without surgery, injections, and pain medications. I hope this video was helpful. Give us a thumbs up if it was for you. And don't forget to subscribe, guys. We'll see you in the next video. Bye-bye.